Yes, ladies and gentlemen, welcome to another live that I had promised you that we're gonna do at Lifestyle and Health. Angela is my name, and tell me where you are tuning from so that we can start this on a very high note. Yeah, thank you for joining in. I intended to do this at exactly 8 p.m., but I've started a little bit early so that we can move on. I don't want to be late today. Yeah, so as you stream in, you can be telling us where you're watching us from so that we can give you a high five from Kenya. Yeah, so the live is about diabetes, and I'm going to focus or to gear all my energies on diabetes type 2. Yeah, from Kenya, yes, diabetes type 2. And the reason why I'm so interested to discuss about it is, thank you. It's one of the conditions that you are referring your patients to come to us so that we can help in reversing the condition. Now, diabetes is such a broad topic that most people don't even understand where they're suffering from, but they've been on treatment and care for prolonged durations. And this, of course, comes with a lot of challenges, because if you don't know what is ailing you, even the recommendations or the advice that you'll be given in regard to your condition becomes a problem. Okay? And there are different types of diabetes. You already know there's diabetes type 1, type 2, type 3, and we're going to discuss, to touch on them. Not to discuss at length, but we're going to touch on some of them, yeah, and to help you understand the difference in all that. And the objectives of the lessons today, we are going to define diabetes in the most simplest way possible. I have a board here, yeah. The objectives of the lesson is we are going to discuss the definitions, okay? I'm going to give you the ranges of blood sugar levels, okay? I'm going to give you the hormones, to explain the role of the hormones when it comes to the regulation of the blood sugar levels. We're also going to discuss about the complications of diabetes, yeah? And also the types of diabetes. So as you stream in, yes, as you stream in, you can be telling us where you're watching us from so that we can appreciate you for coming in. Once again, I want to thank you all for finding some time to join in. I know you could be doing so many other things in your place, and of course also taking one for the road, but you found some time to be here. Thank you. So diabetes, if you ask most people what diabetes is, they always explain that it is the elevated sugar levels in the blood. Yeah. Why? Because the tests that are done, they only check on the amount of the sugar in blood. Maybe the random blood test, yeah, the test that they prick this finger, and then they take some sample, and in like 1 minute or less, they already have the readings. It's called the either fasting blood sugar or the random blood sugar. The difference between the two, the fasting blood sugar is the one that you are taken, that is taken when you are hungry, early in the morning before you start feeding. And then the random blood sugar is the one that can be taken randomly, whether you've taken food or you've not. It's called the random blood test. So if you ask most people what diabetes is, they will only tell you that it is the elevated sugar readings, okay? But that is not the case. That is not diabetes. Elevated blood sugar readings means that is it's called hyperglycemia. Okay, and hyperglycemia is a symptom of diabetes. Underline that. Elevated blood sugar readings means that is hyperglycemia or high blood sugar levels. Okay, so what is diabetes? And when you come to therapy, you realize that even the drugs or the treatment that is intended or presumed to help you in lowering your blood sugar levels only focus on the amount of the sugar in the blood. But I'm going to tell you the right definition so that you understand how are you going to reverse your condition. Because one, diabetes is reversible, particularly the type of the diabetes that we are discussing right now. Basically, all of the types of diabetes are reversible, including that diabetes type 1. Okay? Now, what is diabetes? Diabetes means that you have a lot of high sugars in the system. Underline that. And system does not mean just the blood sugar. Just the blood sugar. It also means that you also have a lot of sugar in your cells, okay? And then these sugars are stored in different cells of the body, which I'm going to explain on this same video, okay? So when you have high blood sugar levels, and then you go to the hospital, and then you'll be given drugs for management of diabetes, maybe the metformin, or you'll be given the insulin. You ask yourself, when this insulin or this metformin or these drugs that are intended to lower the blood sugar levels, where do they take this sugar to? After lowering the amounts of sugar in blood, where does it go to? Because of course, sugar is not supposed to leave the body through the urine or through the sweat, unlike the salt, you know. In most cases, you find that the drugs, these drugs, they only focus on the sugar. But we have different cells in the body that stores the sugars. Okay. Like for example, if you took a carbohydrate-rich diet, yeah, maybe rice, maybe chapati, maybe a cake or soda, an hour down the line, you will elevate the levels of sugar, the blood sugar readings, okay? And when the levels go up, you'll trigger the release of a hormone that is called insulin. I'm going to explain what insulin does in relation to the blood sugar levels regulation. So when insulin comes in, it opens the receptors for glucose. It works like a gate. It opens the gates, and then the sugar starts to flow from blood to the cells. And the cells that store the glucose in the body are 3: muscle cells, fat cells, and the liver cells. So for short durations, you realize that glucose will be stored in the liver in form of glycogen in the liver. But for prolonged storage, this sugar will be stored in the muscle cells, okay? And this is why it will be utilized for energy. And then the fat cells for prolonged durations. This is how you gain a lot of fat. And you don't gain the fat because of eating fat-rich diets. You gain a lot of a lot of weight by chronically consuming the carbohydrates. Okay, so before we even get there, I want to give you the readings, the normal readings for the blood sugar level. They range between 3.9 to 5.5 millimoles per liter. I don't know whether you TikTok, can you see? TikTok, can you see? Yeah, it's 3.9 to 5. Thank you for liking the live. 3.9 to 5.5 millimoles per liter. These are the readings. These are the normal readings for the blood, the blood sugar. Okay. If these levels go slightly up, maybe you took the carbohydrate diet, yeah, you'll spike insulin. This is a hormone that is produced by the pancreas, the beta cells of the pancreas. They produce the insulin. And then this other hormone that is called the glucagon will be produced by the alpha cells of the pancreas. Now, when the levels of sugar go up, insulin will come in and then try to control or lower these sugars by opening the gates. Okay, when you open the gates, the blood, the sugar starts to flow to these 3 cells. Okay. Yes, as you join in, also remember that this live is also live on YouTube. On YouTube, you can go there, all of you, 160 of you, yeah. And then you go and show support by subscribing to the YouTube channel. So for those of you who are missing the live, you can go back to it later and watch it, and you are going to learn a bit. When you are seated, there is no hurry. You can even share it. So we heard you when you say that this live should be recorded. So the live is about diabetes. Again, diabetes type 2. So I've explained the phenomenon that happens because after consumption of carbohydrates, because diabetes is a carbohydrate condition, okay? You raise the levels of the sugars, and then you trigger the release of the insulin, and then insulin acts as a key, opens the gate, and then sugars flow from the blood to the cells for storage. For short durations in form of glycogen in the liver, and then in muscle cells for utilization in energy, and then in fat cells for prolonged durations. Awaiting for the time, the reason as to why glucose is stored in form of fats, awaiting the time when you'll be either sick, there will be disaster, and then you'll not be able to feed. So the body will turn to these fat cells and then start to break them down again and supply your system with energy. So you're not going to faint even when you are sick. Okay? The body is perfectly designed. Now, before I even get there, I've told you that the elevated sugar levels is not diabetes. That is called hyperglycemia. All is a symptom of diabetes. Is a symptom of diabetes called the hyperglycemia. So what is diabetes? You have too much glucose in your blood, and also these cells have filled up. How do these cells filled up? You chronically take carbohydrates. For example, in the morning, you take ugali, YouTube. Yes, YouTube name. The link is on the bio. Click on the bio, you find the name of the. You find the link. It is Lifestyle and Health on YouTube. You click there and then you join. You can ask your questions from that point. I'm going to see them and I'm going to respond. So, for you to be diagnosed with diabetes, it doesn't happen in a day or in a week or in a month. This is chronic consumption of carbohydrates. Okay? So over a decade or years, you've chronically been consuming carbohydrates to a point that these three storages are full. Okay? I was giving an example of when you wake up in the morning. You take bread, you take butter, you take margarine or honey, and then you take some juice, you take tea with sugar. Okay? And then come 10 a.m. in the office. You take more carbohydrates. Maybe you take chapati with some tea. At lunch hour, you take something like rice and something like dengu or beans or whatever it is, and then some cabbage. Okay? And then as you go home, you take more tea at 4 o'clock, maybe with another snack. And then at night, you take ugali. So this is just one day. You have 5 meals of full of carbohydrates. And then over a long period of time with that type of feeding, you'll chronically be spiking insulin. Anytime you take carbohydrates, you spike the insulin. It comes and stores in these fat cells. You spike insulin, after another consumption, it stores. So chronically, these cells will be full. And when they are full, even when you give an external shot of insulin to try and open these gates, sugars will actually flow from the cells back to the blood, elevating them, the blood sugar levels. Okay, so the definition about the elevated sugar level readings is wrong. The right definition is you have a lot in your blood and also in your cells. Now, I've given you the ranges. The normal ranges of blood sugar is between 3.9 to 5.5 millimoles per liter. And that is maintained by those two hormones. I've explained about the insulin. It is called the fat storing hormone. Why? Because it gets the sugars and then stores them in these three cells. When you are starving or when you are fasting, there's a difference between fasting and starving, because fasting is intentional. You want to fast for whatever reasons, for whether religious or even the health benefits that comes as a result of fasting. When you're fasting, this hormone will be the one which will be more. It is called glucagon. Glucagon is also produced by pancreas. It's produced by the alpha cells of the pancreas, and this goes to the alcoholics who chronically take alcohol, and then it messes up with your pancreas. And I'm also going to give you the list of the drugs that are used in the management of diabetes, which puts your pancreas at risk. Yeah, so tag that person who is taking Triviamet. Now, glucagon does the opposite of what insulin is doing. It turns to these fat cells. I told you, glucose is stored in prolonged durations in form of fats in fat cells, and then it starts to break them down when you are fasting or when you are hungry. Or when you're starving. When fat cells will be broken down, you get something that is called ketone bodies. That process is called ketosis. You break down these fat cells to get ketone bodies. These are the best, and these are the best energy sources for use for your brain and your body functions. Okay, so glucagon, anytime you're fasting, this goes to diabetes patients, because for you to recover your condition, you have to fast, either intermittent fasting or the prolonged periodic fasts. But the fear with these diabetes patients is that they've been told that when they fast, they are going to go into hypo and they are going to faint. That will not happen because of another process that you're going to review that is called gluconeogenesis. Okay? So when this glucagon comes in, it breaks down these fat cells, it supplies the body with ketone bodies. This is how you start to lose weight. If you're obese or you're overweight, you start breaking down the fat cells, of course, you start to reduce in size, or you stop accumulating all the fats. Okay? Now, have you understood the difference between the insulin and the glucagon? Class, have you? Good. Insulin, glucagon does the opposite of the insulin, but both of the hormones, thank you, both of the hormones are synthesized by the pancreas. Now, let me list for you some of the, not the complications, but other signs, even if you're not diabetic. You know, I've seen people, when you ask them, have you ever taken a blood sugar test? They always rush to tell you, yes, mimi sinanga sukari, I don't have diabetes. But you could be pre-diabetic. For example, if you have one of the signs of high sugars in the system, stroke. Unfortunately, there are people with patients with stroke, but if you ask them what is stroke, they only tell you that pande moja imepooza. I mean, paralysis of one side, yeah? Maybe the eyes or even both sides. So this patient is lying down all the time. But you cannot tell the pathogenesis or how this, the disease process and how this patient was diagnosed with stroke. Now, stroke is a complication of high sugars in the system. Okay? Number 2, blood vision or eye problems. Anytime you are not seeing clear, maybe you used to see properly, but then you start seeing that your vision has been impaired. You have blood vision, or sometimes you lose your sight completely. This you've seen in patients with diabetes. Completely, you suffer from eyesight. Okay? That is another complication of diabetes. Why? The high sugars in the system will block the nervous transmission towards your eyes. There is a nerve that supplies your eye that is called optic nerve. When optic nerve will be affected by sugar, you get something that is called retinopathy. Okay? And when this phenomenon happens, you'll not be able to see properly. So that is a complication of sugar. So whenever you undergo those surgeries, that are presumed to help you in restoring your sight, just know that you're managing the symptoms, because if you've not handled the high sugar levels in your system, of course the same problem will recur sometimes in future. The other sign of high sugars in the system, you might not be diabetes, you might be pre-diabetic, and I told you 70% of the population is pre-diabetic, but they don't know. So you'll be exhibiting the signs of diabetes. The signs of diabetes, like polyuria, that is frequency in urination, polyphagia, okay, and even dust, a lot of dust, and also the tingling sensations. There's a video I did on TikTok that I was talking about the numbness and the hot feet, and I was shocked that the number of people who are claiming that they're having hot feet at night the number is so high. Those are typical signs of prediabetes. So don't wait until you're confirmed diabetic. Just add it to that. And I'm going to give you the list of the foods that these diabetic patients are supposed to take. So I've said signs of high sugars in the system are 1, stroke. Okay. Number 2, blood vision. Okay. Number 3, recurrent yeast infections in women. Why are women having recurrent yeast infection? You treat it. And those are fungal infections, So of course you treat with drugs like the ketoconazole, fluconazole. Sometimes you are given the pessaries, the vaginal pessaries to insert, the clotrimazole pessaries and the like. But you treat it, it doesn't go away. You treat it again, it doesn't go away. Recurrent yeast infection. Women, we have yeasts in our system. It plays a lot of different roles in the system. However, if there is yeast overgrowth, the yeast starts to overwhelm your system. And how do you end up with the overgrowth? You end up with the overgrowth by overfeeding the yeast. So because you have too much sugars in your system, you are providing substrate or food for the same yeast. So it leads to multiplication of the numbers. So the numbers increase, and therefore predisposing you to the recurrent yeast infections. Yes, the topic today is about diabetes. So you can be sure not answer any other question that is not related to diabetes, okay? So recurrent yeast infection that you've tried to treat that is not going away. Query: high sugars in the system. Is honey bad sugar? Yes, honey is bad sugar because it contains a sugar that is called fructose. And fructose will come to predispose you to diabetes, prediabetes, and all these issues that I'm highlighting about. The other sign of high sugars in the system is low immunity. Sugar lowers your immunity. And this is why you see the children that are fed on junk, they are fed on bread, margarine, honey, juices, you know, pizza and all that. These are the same children that you'll always find in hospitals, yeah, with tonsillitis, with pneumonias, with, you know, a cold that is not going away, sinusitis, because the immunity of these children have been reduced by the amount of sugar that they are consuming each time. Okay, so very low immunity. Even diabetic patients, yeah, you always see, if you have a patient or a relative or a next of kin who has diabetes, any cold that comes, they have it, yeah. Any infection that comes, they have it. You remember during the COVID time, the people who are mostly affected by the COVID are diabetic patients and people with immunosuppression. Why? Because the low immunity cannot allow them to fight. Yeah, cannot allow them to fight all these conditions and overwhelm them. So low immunity could also show or indicate that you have very high sugars in your system. Okay, heart disease and hypertension. But I'm going to discuss about the heart disease as part of the complications of high sugars in the system. So hold that thought for now. That is a thought for a later review. Okay? When you have high sugars in the system, another thing that you see, you might end up with troubles to do with the kidney problems. And you know, once your kidneys will be affected by the high sugars, yeah, sugars will lead to something that is called nephropathy. Why? Because the nerves that supply towards your nerves, towards your kidneys, will be affected. When this phenomenon happens, you already know the functions of the kidneys. One, synthesis of vitamin D. The last activation of vitamin D. By now you already know that you get vitamin D not from the sun, but from cholesterol. And then this cholesterol will be broken down to give a form of cholesterol that is called cholecalciferol. And then this cholecalciferol will be deposited on the skin surface. Now, if you scratch to your skin, maybe on the hand, you'll see a white tissue, or just a very slim part of the top skin. You'll see some white part of the inside of the skin. That is called an adipose tissue, particularly the white adipose tissue. You know, we have two types of adipose tissue, the brown adipose tissue and the white adipose tissue. So what you see is white adipose tissue. Now, this is where cholesterol is deposited in form of cholecalciferol. And then it will require the activation by the ultraviolet radiation. It hits the skin surface, and then it converts that cholecalciferol to another compound and then transported all the way to the liver for partial activation. And the last activation is done by your kidneys to form the active form of vitamin D that is called the calcitriol. Okay, so if you have failing kidneys because of sugar, you will suffer from vitamin D deficiencies. Why? Because the last activation of this vitamin D cannot happen because your kidneys are failing. You cannot form the calcitriol. And then when you have deficiency of vitamin D, one, you will have low immunity because vitamin D is actively involved in immune building. Number two is that you'll start to have very weak and brittle bones. You have issues to do with osteoporosis, osteomalacia, rickets in children, okay? All these are likely to occur. All these are going to happen because of low vitamin D. Again, when you have failing kidneys because of the sugar, you are going to suffer from low blood volume. Low HB levels. Why? The kidneys are actively involved in production of blood cells, particularly the red blood cells. your kidneys produce a hormone that is called erythropoietin, or the EPO. And the work of this EPO is to instruct your bone marrow. Bone marrow is a site where red blood cells, white blood cells are synthesized in. So the EPO sends instructions to the bone marrow to release or to mature the stem cells, and then supply the system with mature red blood cells. And blood cells are the ones that carry the hemoglobin, or the HB. So if you do not mature the stem cells to give us the red blood cells, of course you start to suffer from deficiency or low hemoglobin levels. What are you going to end up with? Anemia. When you have low HB, anemia will be there. Okay? So the kidney plays a very big role when it comes to the regulation of blood pressure, and also the blood cells and the immunity. Okay? Regulation of blood pressure. If you alter your kidneys through sugar, you start to suffer hypertension. I've seen somebody who is asking me, what is the relationship between diabetes and hypertension? Why is it that somebody starts with diabetes medication and then ends up taking diabetes medication and hypertension medication? These two conditions are related. They actually, people call them cousins. Okay? Or you started with hypertension and then you ended up with diabetes. Okay? Sometimes this already means that by the time you're being diagnosed with hypertension before diabetes, you are already in pre-diabetic stage. Hold that thought. When you're being diagnosed with the hypertension, it means you're already in your pre-diabetic stage. And hypertension is not a salt problem. Hypertension is a sugar problem. Okay? All these sugars that we're saying are all over the cells, are all over the blood vessels, and and even in the blood vessels. Okay? That sugar will bind, because sugar is a very sticky substance. Thank you to all of you, 279 of you, 276. Imagine all of you, if you clicked my bio and then clicked the link on the YouTube and then subscribe to the YouTube, you will be getting such content every Tuesday and Friday. And you have reference. So all of you, it's time to go there. 280 of you. You go to my YouTube, you go to the link on the bio, click it, it will take you to the YouTube. Subscribe, ask your questions there. This is the place that I can be able to read the questions, and like in YouTube, like in TikTok, because TikTok is moving really fast. But on YouTube, I can be able to see and I respond. But I ensure that your question is related to diabetes, hypertension, and all those things, and all those complications or issues that I listed are signs of high sugars in the system. So, back to what I was explaining. I was saying that kidneys are involved in regulation of blood pressure. But before we even get there, I was saying that sugar is a very sticky substance. If you had a glass of tea or a cup of tea, and then you added some sugar, and then you stirred it, and then some of it spilled on the table, and then you left that table unattended, if you come back and touch that table, of course it will be very sticky. This same phenomenon happens in the blood vessels. Okay? The sugar will attach to red blood cells as they move between the blood vessels. And then when they stick, they'll also stick on the walls of the blood vessels. When they stick there, of course, they reduce the diameter of the blood vessel. It will start to narrow. When this happens, it will trigger the heart to enlarge as an adaptation, so as to pump or to push blood through the narrowed blood vessel. Okay, so you have sugar, it binds to blood cells, and then it attaches on the walls of the blood cells. Okay, the epithelial lining of the blood vessels, and then when it attaches there, it narrows the blood vessel. So I ask you, between a very narrowed blood vessel and another one that is wide, which one transports or carries water or fluid with intense pressure as compared to the other one? Definitely the narrowed one. Okay. Sorry about that. The narrowed one will increase the pressure through which the heart has to pump blood through to push it through the narrowed blood vessel. As a result, because of the narrowing of the blood vessel, the heart will enlarge. That is called cardiomegaly. An example, those people who go to the gym, with time they build up the biceps. The muscle starts to build up or to enlarge. Why do they enlarge? They enlarge to help this person to lift even heavier weights. Okay? Yeah, so as to help them as they continue training. If they were taking or they were lifting like 20 kgs, they go to 40, they go to 60 and all that. So the increase in the muscles or the enlarging of the biceps is an adaptation to help this person in lifting more. If they stop going to the gym, the muscles or the biceps will go back to their position. Similarly, the heart is enlarging at this point in time, so as to help in pumping the blood through the narrowed blood vessel. If you remove whatever is occluding the blood vessel, of course, the heart will go back to its position. Okay? Cardiomegaly. So whenever you hear somebody telling you about cardiomegaly, don't be scared. That simply means that your heart has enlarged. And I've told you it is enlarging as an adaptation. Good. The other role of the kidneys in relation to the blood levels. Yeah. No, let me not go into details about the kidneys, because we are going to discuss about the kidneys when we'll be discussing about the acute kidney disease and the chronic kidney disease. And I'm going to tell you about the staging of the kidney disease. How do you end up with dialysis? How do you end up with a kidney transplant? That will be another live. Okay? So 347, 350 of you. If you go to my bio, you'll find a link to the YouTube. You can subscribe to show support. I always see where the comment section saying, yeah, you changed my life. I have been trying the things that you recommend. If there's something that I would request from you, is that you can subscribe to the YouTube channel so that you can help us grow, so that we can be sharing much more content that is related to health. The other effect of high sugars in the system is erectile dysfunction in men. Erectile dysfunction. This is where it gets interesting. For you to attain an erection, two things must happen. There must be nervous transmission towards your penis, and there must be blood flow towards your penis. Okay? Now you have sugar that is binding to blood cells and then occluding the blood vessels. When it occludes the blood vessels that are supplying to your penis, of course, the penis cannot gorge with blood. So where are you going to get the erection from? The same sugar is blocking the nervous transmission to different parts of the body. So when you block the nervous transmission towards the penis, where are you going to get the erection from? This is why people with diabetes also suffer from erectile dysfunction. Yeah? And then they'll not even understand where the problem is coming from. So they'll look for shortcuts. And the shortcuts they are going to get, or they are going to settle for, taking the sildenafil. Yeah? And that is a drug that is used in management of pulmonary hypertension to raise your blood pressure. Okay? So imagine if you're somebody with hypertension and diabetes, and then you take sildenafil, the drug that is commonly called the Viagra, you will die, because hypertension is high blood pressure. And then you take another drug that is treating hypertension. So definitely that means that you'll even increase the blood pressure even more. Trouble. Okay? Good. The other complication, or the other not the complication, but a sign of high sugars in the system is memory loss. Memory loss or dementia. If you find yourself forgetting even the pettiest or the most interesting thing, question sugar. Forgetfulness, Alzheimer's, dementia. These ones are actually classified under type 3 diabetes. Type 3 diabetes. Good. So have you understood the signs of high sugars in the system? We started with stroke. Okay. The second one is blood vision. The third one, dental problems. Let me explain something about dental problems. You have a tooth problem, and then you undergo the extraction. It is removed. Another year, another one is removed. And then you don't understand where it's coming from. It is the sugar, because sugar blocks the nerves, blocks the blood vessels that are transporting or supplying your teeth. And this therefore means that if you have an infection on that tooth, you cannot transport immune cells to that tooth, so the infection even becomes more. You can also not transport nutrients to that tooth, and you cannot transport oxygen to that tooth. Okay, so that is number 3. We started with stroke, blood vision, dental problems, recurrent yeast infections in women. Okay, and then low immunity, and then kidney problems. And I've listed the kidney problems that are likely to occur when your kidneys are affected by sugar. Heart disease is another one. Erectile dysfunction is another one. Memory loss is another one. So all of these are signs of high sugars in the system. Are we together, class? Thank you. So I've requested, I'm actually pleading with you. Go to that YouTube channel. The link is on the bio. Click on it, and then it will take you to the YouTube where we are. Yes, thank you. Thank you. Tuko wengi. Thank you. So, types of diabetes. Types of diabetes. There is diabetes type 1, type 2, type 3, and then you guys don't understand what is the difference between all of them. Now, I'm going to start with the particular one that I'm talking about today. It's called diabetes type 2. This is a lifestyle condition. It is a dietary condition. Okay? The life you choose to embrace will either predispose you to diabetes or keep you safe, free from diabetes. Okay? And you realize that this diabetes type 2 is actually diagnosed in people above 30 years. And the greatest percentage of the population are people who are in their 40 years, 50 years and above. It is caused by sedentarism. Maybe around that time you realize that this is where people start having some resources. They can achieve a lot of food, a lot of junk. You know, they have bought cars, so they are not even walking. It's from home to office, and then from office to the car, you know. And then you go buying two for the road, and then you gain a lot of weight, and then you have a pot belly, and then in a few days or months, where diabetes type 2. It is as a result of change of lifestyle, bad eating habits, okay, and sedentarism. So what is diabetes type 1? Type 1 is normally share. Okay. It's hanging. What is hanging? The live is hanging on YouTube. Somebody confirm whether the YouTube is hanging. No, it's not her. Thank you for confirming. Hey, ningeshtuka. I would have wondered where we are going to get the reference for all these information. Now, diabetes type 1. It is usually diagnosed in childhood. What is diabetes type 1? I have said this range. Yeah, this range of blood sugar is maintained by two hormones, glucagon and insulin. And insulin does the opposite of glucagon. The network is okay. Thank you for confirming. Now, in diabetes type 1, you have in diabetes type 1, you have non-functional beta cells. Let me write here. I've said insulin. Insulin is produced by the beta cells, yeah? Let me see the one that is going to write. Let you understand. Beta cells, they produce the insulin, okay? And then the alpha cells, they produce the glucagon, okay? So when you have diabetes type 1, you have non-functional beta cells. So these are the cells that produce the insulin. So if you have non-functional beta cells, this therefore means that you don't have a source of insulin. So this is why you'll find these patients with diabetes type 1, they'll be put on synthetic insulin. They get the injections of the insulin. But this diabetes type 1 is also reversible. Why? you know, if it's a child, this child will really survive, will survive very fast, because the cells are rapidly multiplying as they are growing. New cells will be generated each time. So you can actually have you can actually trigger the release or production of cells that are insulin sensitive in diabetes type 1. Okay. However, if this kid or this patient is on very high amounts of insulin, you're actually killing the beta cells even more. Why? Because if you can get a synthetic shot of the insulin, then the body doesn't have to work to give you the natural insulin. So you have to work hand in hand with your doctor to taper down the dosages of the insulin so that your body can start producing the natural insulin. And you will need insulin if you're taking carbohydrates. So what should the diet of this child be? Zero carbohydrates. Zero carbohydrates. When you go off carbohydrates, you'll not keep on triggering or needing the insulin. Okay. However, this should not be stopped. The insulin should not be stopped abruptly. You should work hand in hand with your doctor. Okay. Diabetes type 3, I've explained. It is diabetes type 3. I've explained it's the Alzheimer's, dementia, forgetfulness, and yeah, these are the ones that are classified under diabetes type 3. So type 1 is where you have non-functional beta cells. Also, why did I forget this? You can even have an autoimmune condition. We say autoimmune is where your body is not able to differentiate between your own body cells and the cells of the body and your foreign cells. So the immunity is supposed to detect only the foreign cells and destroy them. But when you have an autoimmune condition, it means you cannot be able to differentiate what is foreign and your own body cells. So the immunity starts targeting even your body cells. In this case, in diabetes type 1, you could have an autoimmune condition that is targeting these beta cells. When you target the beta cells, therefore, this means that you will kill them. So you will not be able to produce insulin. So this is why diabetes type 1 is also classified under an autoimmune condition. Good. Are you joining in? Have you asked questions on YouTube? Can I see some of the questions so that I can answer? But remember to be very, very, very objective. And then you ask the questions that are related to diabetes. I'm going to answer as they come. Yeah? Good. Are we together? So what are the complications of diabetes? Complications, so one is heart problems. How do heart problems come about? I've told you the high sugars in the system will block the blood vessels that are supplying to different parts of the body. If the blocking of the sugar in the blood vessels happens to the blood vessels supplying to your brain, you get a stroke. If it happens to the muscles, to the blood vessels supplying to the heart, you get heart conditions because you cannot transport nutrients even to that heart or oxygen. Okay. Hypertension is a complication of diabetes. This you already know and I've explained. Stroke, recurrent yeast infection, all these I had explained. Okay. I want to tell you something about, let me flip this. Good. Before we even come to the drugs, I've written some of the drugs here. Some of the drugs that are used in management, not treatment, management of these conditions. And I've told you these conditions are not for a lifetime and they are not genetical. If you are there, even if you don't remember anything, just remember that these conditions are not for a lifetime and they are not genetical. They have nothing to do with your genes. What contributes to you having diabetes or hypertension are factors that are called epigenetics, not genetics. Epigenetics are environmental factors, okay, that trigger the genes to come and cause the diseases, okay? Environmental factors, and diet, lifestyle are part of those environmental factors. Cheers. Good. Now, I have these terms that I want to demystify. The DKA, ketosis, which is also called ketogenesis. DKA is called diabetes ketoacidosis. Let me write. I don't know whether I'll be able to write. Diabetes ketoacidosis. There's a difference between diabetes ketoacidosis and ketosis. Now, if your doctor ever told you that as a diabetic patient, if you fast, you are going into DKA, that is wrong. That is a liar. Okay? No, I cannot talk about Helicobacter because this is a live on diabetes. So what is DKA? What is ketosis? Ketosis or ketogenesis refers to the production of the ketone bodies. And you only produce ketone bodies are the best energy sources for your brain and your body. Okay, they are alternative sources of energy apart from glucose. I know most people believe that all the energy has to come from glucose. The other sources that are called the ketones, and they are the best as compared to the glucose that helps in supplying the system with the right energy. And even the brain actually appreciates ketone bodies more than glucose. But for you to get the ketone bodies, you have to fast. Okay, so when you are fasting, your body turns to the fat cells, the ones that we talked about here, and then breaks them down to give you the ketone bodies. That process is called ketosis or ketogenesis. Genesis simply means a beginning. Okay, ketosis or ketoacidosis. This is where you are fasting. Yeah, you are fasting, and then you need these other sources of energy in form of ketone. So you break down the fat to give you the ketone bodies. Now, what is DKA? This is a complication of diabetes, and whenever the patients are vulnerable or they cannot be able to understand some of these concepts, the doctors will take advantage of their naivety and then scare you that if you don't keep on snacking on sugar, keep on snacking on glucose and all those foods, yeah, you'll be told that you'll end up with DKA, diabetes ketoacidosis. By the name, you already know that this is a phenomenon that happens in patients with diabetes. Not any other person, but people with diabetes. Okay? Ketoacidosis means you already have very high levels of sugar in your system, but you cannot be able to utilize it. So what happens? The body now turns to the fat cells and then starts to break them down to give ketones. So you already have two energy sources in the body. You have the glucose you cannot utilize, and then you have ketone bodies. Okay? These two ketones are highly acidic. You know, the pH of blood ranges between 7.35 to 7.45. That is almost neutral. So when ketones come in, they lower the pH of blood. When they lower the pH of blood, that becomes an emergency. This is why DKA patients are admitted, and then they have symptoms of the vomiting, diarrhea, sweating, lack of energy, extremely high sugar levels. When you do the random blood sugar or you do the fasting blood sugar, you'll find they have very, very, very high amounts of sugars in their blood. Okay. Some of the complications of diabetes are the ones that I've highlighted. The retinopathy is where the optic nerve, the nerve that supplies to the eyes, are affected, and then you end up with blood vision. Okay. Nephropathy is where the nerves that supply to the kidneys are affected, so you end up with kidney problems. Peripheral neuropathy is where I said you start to have the tingling sensations on the feet. You have pain, you have numbness, you have very hot feet or very cold feet. Okay. You feel like somebody is piercing you with the needles on the feet, or the soles of the feet, or even on your joints and your muscles on the feet. That is peripheral neuropathy, and it is a nerve problem, including sciatica. Those who keep on asking me about the sciatica, that is also a nerve problem, and sugar is the one that blocks the nerve transmission towards different parts of the body. So that is a symptom of high sugars in the system. Now, the drugs that are used in the management of the diabetes includes the metformin. You could be taking the metformin 500 milligrams, 850 milligrams, 1000 milligrams, okay? And then a combination with another one that is called Nogluc or glibenclamide. Okay, these are usually the first, the initial treatment for a patient who is newly diagnosed with diabetes. But as they progress, as they get the complication, you'll find that maybe sometimes insulin will be added, or the whole regimen is changed from metformin to a combination, a formulation that contains maybe the gliptin, like the sitagliptin, maybe 50 milligrams or 100 milligrams in combination with metformin, like 1,000 milligrams. Okay, the effect about this sitagliptin and this class of drugs that ends with gliptin is that it kills your pancreas, and it predisposes you to pancreatic cancers when your pancreas is affected, okay, by these drugs. It means you'll need treatment for a lifetime, because pancreas is the one that is producing these same hormones, glucagon and insulin. So when you kill it, you'll have to rely on the synthetic drugs, like these ones that you're talking about, or even the insulin. Okay, so what takes you to hypo? I know people who are diabetic will start to ask me, why do people faint? You don't faint because of hunger or fasting. You faint when your levels of glucose go down because of side effects of the insulin, particularly, or even this drug called glibenclamide or Noglu. These are the drugs that have the side effect of causing the fainting. Okay, good. So as we conclude, is there anybody who has requested to join in and ask a question that is related to diabetes? If you ask a question that is not related to diabetes now, you can be sure I'll drop you, because I want us to, if we say it is diabetes, let us learn about exclusively on diabetes. Okay, what are the foods for these diabetic patients? I've told you diabetes is where all your cells are filled with sugar. So therefore, this patient does not need any other source of glucose. No. They already have enough for them to utilize and to burn what they already have. Take a carbohydrate-free diet, not even the complex carbohydrate. Let them be on meats and vegetables only. All types of meats. You can change or you can remain with one. Take eggs. Take all the vegetables, the green leafy vegetables or the cruciferous vegetables only. And then take these foods twice a day or once a day. That is enough. And then sometimes when you can be pushing like a 36-hour fast or 48-hour fast. As you talk to your doctor to taper down the treatment as your sugar starts to stabilize. Do that consistently. Don't do it today and then tomorrow you are checking whether your levels of sugars have dropped. Remember, this is a condition that you've developed over a long period of time, so you don't expect the results that time. You have to be very, very patient. Yes, those of you who are joining, we also live on YouTube. You can go to our YouTube and subscribe. Yeah, thank you. Thank you to all of you who have joined in. Thank you. We're already at 500. So I appreciate your support. And those of you who are joining, feel appreciated. Go there. This live will be uploaded in a few, so you can check in what we've discussed tonight. And we look forward to meeting again. Come on Tuesday. So the foods of a diabetic patient should be meats and vegetables only. Zero carbohydrate, no junk. And this goes to those people who are buying the diet soda for your parents. They don't need it. There's nothing like diet soda. That is, those are marketing strategies. That is actually called deceptive marketing, where somebody puts a name or a tag on a commodity so as to make you believe that it is safe for you. So there's nothing like diet soda. They don't need soda anywhere. Let them take the vegetables. Let them do exercises wherever possible. Okay? But remember, if they are obese or overweight, that weight has to go. And it will go easily by dropping all the carbohydrates and the glucose. Okay? So, is there anybody who has requested so that I can see whether we have any questions we can talk about? We can answer. Call in. Yes, the lives will be every Tuesdays and Friday. Every Tuesdays and Friday. You'll always see the time. I'll be posting the time every day. Thank you for all of you who are gifting us, and those of you who sends us M-Pesa messages through the numbers on the bio. We appreciate that you acknowledge that we are doing something. This is free information and you can share with the people you value or the people you love. Can somebody with diabetes mellitus take honey? No, I've said honey is sugar. You don't need sugar. This person already has a lot of sugars in their cells. So you don't need any more. So anybody who has requested, we have a conversation. Mugabe Richard. Let me start with you. Yes. Okay. Anybody else who has requested that we can have a conversation? Gato Francis.
Hello.
Yes, how are you?
Hi, madam.
Good. Good evening to you.
Yeah, please. I'm watching you from Ghana.
Yes, Ghana. How is Ghana?
It's okay. I really want to come to Kenya and come and see you. I've been diabetic type 2. I don't know. They asked me to be taking governor.
For how long have you been taking it?
Let's see. 6 months now. It's not up to 6 months.
Okay. What is your current body weight?
It's 84. Yeah, 84.
Okay. And what's your height?
My height is 180.
Okay. How many times do you eat in a day?
Now, since I follow you, I've tried to be eating 2 times daily.
Okay.
And be taking water with salt. So
okay.
Every day.
Okay. Are you on any carbohydrates in your diet?
Pardon?
Are you taking any carbohydrates in your diet?
The only food I eat is I don't know,
complex carbohydrates.
Yes.
Which complex carbohydrates are you on?
They come like cook with do you know? I don't know how you call it. I don't know how I'm going to call it, like a bowl, you know? Rice bowl. I'll do it like a rice bowl.
Oh, rice.
No rice, like it's called maize.
Okay.
Maize, I do it like rice bowl and eat it with oko stew or something.
Okay.
Or this thing.
Do you take fruits?
I took apple. Now, since I follow you, I'm taking apple, but I don't know apple is okay.
No, apple is not okay. It's not okay because it contains a sugar that is called fructose, yeah?
Okay.
And you don't need it. You don't even need honey.
Okay.
Okay? So just as I've said, yeah, do this. On your diet, just take meats, fatty meats for that matter, and vegetables only. Maybe you can be taking, you take, also nuts are okay. And then you take some bone broth. And then your tea should not contain milk or sugar.
I don't take milk. I stopped taking tea. I even stopped taking, even rice.
Okay.
Today I take rice. So
okay.
That's all.
So,
and it's making me not see clearly sometimes.
You are not seeing clearly. Those are signs of pre-diabetes. The ones that are just discussed on this live, yeah? You can also go back to the live and listen in again.
Okay.
Okay?
I guess.
Yes, and then be very patient with yourself because this is not a condition that you get or you'll be diagnosed with within a short duration. It develops over a long period of time.
Should I continue to be taking the medicine here?
Yes, continue taking the medicine as you do the readings. Maybe you can be checking your sugars once or twice a week. Are you on insulin?
No.
Okay. So continue with the drugs that you are taking, the ones that you've been put on, and then you observe or you take the readings every week. Observe yourself for close to 2 months.
Is it okay to be taking the machine glucose meter? I have it here.
Yeah, but I discourage people from taking their readings every day. Why? Because that will only increase their anxiety.
Yeah,
okay. So once or twice a week is enough.
Okay.
Okay? And then observe yourself for close to 2 months. If you want us to have a more detailed conversations, you can click on the bio. There are contacts that are provided there.
I'm trying to join your YouTube or this. I don't know. I'm not that type of WhatsApp or how to do it.
Oh no, there is a link. Go to my YouTube on the bio. You'll see the link that is pinned there. Click on it. It will direct you to the YouTube. You can revisit the live again.
Okay.
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 Thank you.
Thank you. God bless you.
Thank you.
I
You're
may
most
have a
welcome.
number for WhatsApp. I don't know.
If you have it, you can talk to us.
Okay.
Okay, bye.
Thank you.
Karibu.
God bless you.
Thank you. Thank you. Who else is here? One more call and then we call it a night. True? Yes, but ensure that the question that you're asking is related to diabetes. All of you have requested. My goodness, we cannot exhaust all of you. Let me talk to Stacy. Hey, it's Stacy. Stacy has disappeared, has vamoosed. Hey. Samson.
Hello.
Yes, how are you?
I'm good, and you?
Yes, I'm fine, thank you.
Yeah, so
talk to us.
Maybe my question will be irrelevant just because mine was about the prostate enlargement.
Yeah. But the life is about diabetes.
No.
Yes. Tell us, what is it about prostate enlargement?
I have a problem with that. I have that problem of prostate enlargement, so I don't know what can I take.
No, were you operated on?
No, not yet.
Okay, what is the doctor suggesting?
I'm going to the hospital on the 9th of December.
Okay.
So, yeah.
Now, prostate enlargement is actually caused by high estrogen in the system. How much do you weigh? What is your current body weight?
105.
105. You have to lower that. That has to go for you to recover from the prostate enlargement, because when you're fat or you're obese, you have a lot of fat in your system. Okay? And then when you're obese, the levels of estrogen starts to go up. And when they go up, estrogen is a building hormone, just like insulin. So it starts to multiply the cells, particularly the cells of the prostatic men. In women, because it's a building hormone, it starts to build the fibroids and the cysts and all that. Okay? So for you to lower this estrogen, you have to shed the weight first. And then when you shed the weight, the levels of estrogen go up, and then testosterone goes, the estrogen goes down, and then testosterone starts to pick up. But when the estrogen is low, yes. Pardon me?
I was having network problems, so you can talk.
Okay. Can you hear me? Hello? Are you there?
Hello?
Yes.
Hello, I can hear you.
Yes, I'm saying.
Yeah, I'm here.
Yes, first things first is that weight has to go, so that you can lower the estrogen, and then the testosterone will start to go up. And then these masses will start to shrink. The prostate enlargement and the cells proliferating or multiplying will start to go down, and this is how you recover. I don't know whether you've seen those patients who have been operated on the prostate issues, and then the prostate grows back to increases again, because that is literally managing the symptoms. You have to lower the estrogen that is causing the multiplication of the cells. I'm going to send you. You can talk to us. Number one, for you to lose weight and the foods that you need to avoid. Are you taking alcohol of any form, whether wines, whiskey, scotch, regardless of whatever type of wine, alcohol you're taking? Are you on any? Hello?
No.
You are not taking alcohol. Are you taking cereals? Okay.
Yeah, I'm not taking alcohol.
Okay. Are you taking wheat and wheat products?
I'm not taking alcohol.
Mm-hmm.
Yeah, wheat.
Wheat, yes, that has to go. Are you taking fruits?
Yeah.
Good, that has to go. The only fruit that you should take is avocado only.
Okay.
Okay. And then what's your cooking oil?
What about the cooking?
What are you using for cooking oil?
From Excella fishing oil.
Fish oil.
Yeah.
Okay. Tell me about, do you do exercises?
No, sometimes.
What is the nature of your job?
I'm self-employed. I'm selling property.
Okay. The fact that you're also not exercising now, that will add you a lot of weight.
Okay.
Okay. Are you taking any form of sugar, either tea sugar or fruits or honey or?
Yeah, tea.
You take tea.
And the honey is my favorite.
Yes, all that has to go. All that has to go. Yes.
Okay.
Okay. Your drink should be the sugarless black tea or sugarless black coffee. And then your meals are supposed to be 2 or less. The first meal should be somewhere around 11 a.m. or 12 p.m. And then the last meal should be before 8 p.m. Now, between 8 p.m. all the way to the following day around 11 a.m., you'll have a whole 16 or 17 hours of fasting.
Okay.
And this will help in lowering your weight, because that has to be the first step, so that now when weight goes, even the estrogen levels will start to go down. Okay. Do you suffer from any other condition?
Another condition is concerning my thigh and on my thigh and on my legs. What? In the morning I've got a muscle pulse.
Okay.
It's very much painful. Yeah.
Do the legs get numb?
Yeah.
Okay. Where is the pain? On the hip?
Yeah, on the hip.
Okay, that could be sciatica. Now, are you on any drugs for that? Or nerve problems or drugs that are used in management of nerve problems?
No, I'm using only this. What do we call for this? For prostate care, prostate management.
Oh, okay.
They call it cardiovascular.
Okay.
Yeah.
Read the name that is below the cardiovascular, the one that is written in milligrams. There's another one that is written in small letters.
They're written for milligram and Mylan.
Okay. Continue with that in the meantime, but edit your diet completely. Do all those things that I've told you. You have to change the wheat. You should not be on any wheat. Okay. Exercises, and then intermittent fasting of meals. 2 meals per day, or sometimes 1 meal per day. And then no sugars, no fruits except avocados.
Okay.
And then observe yourself for like a month. If you may need a more detailed consultations, you can reach out to us through the contacts that are on the bio. And then we can have a conversations and see how we can help.
On the bio?
Yes. That is the office contact.
Oh, okay. I will take them.
Okay. Thank you.
Thank you very much.
You are most welcome.
You are my favorite.
Oh, really?
You are helping me a lot.
Thank you. I appreciate.
Yeah.
Yes.
I'm from South Africa.
You are from South Africa. Where? South Africa is in the building. Thank you. I appreciate. Okay. Thank you. You're most welcome.
Bye.
Bye.
Thank you.
Wow. Ladies and gentlemen, imagine that. Lifestyle and health is all over Africa and all over the world. So, I thank you for being here. You've given me your whole time, all this time. And I appreciate that you are here. So, the only thing that I'll request is you click the bio, go to the YouTube, subscribe on Lifestyle and Health, and help us to grow so that we can give you such contents and such conversations that are life-changing. So have yourselves a good night. I appreciate. We meet next on Tuesday. If you would want to talk to us, the contacts are on the bio. That is not my direct contact. For those of you who keep sending love letters on that contact, that is contact. Those are office contacts. So you just write. If you call and the number is not picked, just leave a message on a WhatsApp, and then say your name and say how you would want to be assisted, and then you'll be booked for a conversation. So, ladies and gentlemen, thank you for those of you who have joined in for the very first time. Consider following us so that you can get more content, and also go through the bio. Also, this live will be uploaded on the YouTube, so you can revisit it and share with the people you love or the people you adore. I appreciate you. Thank you for being here. Adios.